I am joined now by MSNBC Medical Contributor, Dr. Lipi Roy. Dr. Roy, it's great to have you on, as always. Let me pick up on that last story that we were talking about there, what was happening in Gainesville, Georgia, Northeast Georgia. It's a rural part of this country. And obviously, as we mentioned there, a new coronavirus hotspot has now emerged. What should we read into that? How concerned are you that this late into the game, we are still declaring some parts of this country as hotspots when other parts are still opening up?
Yeah, good morning, Ayman. It's always good to be with you. It's concerning, right, from a medical and public health standpoint. What we're seeing right now is what we unfortunately predicted, which is if economies and communities open up too soon before we have public health measures in place to protect both employees and customers, we're going to see exactly what we're seeing, which is a rise in cases. So, you know, again, and these are not two diametrically opposed ideas, the economy and public safety, right? So if businesses are able to open up while maintaining physical distancing, wearing of masks, hand washing, it's feasible. But again, these measures need to be in place or else people will get infected and they'll get sick. And as we talked about, it's going to burden those local healthcare systems and hospitals.
So other states are probably looking at Georgia and see that the outbreak headline, as we've just been reporting, as well as how the state is continuing with its reopening strategy, if you will, or plan. What should other states be taking away from what is happening in Georgia, you think?
Yeah, so, I mean, first ask yourself, what's really your priority? I mean, I understand money's important and getting a paycheck. I get that, and particularly from a health standpoint, because these environmental stressors of unemployment, food insecurity, these actually then adversely impact your existing medical conditions. But what I would encourage other states and communities is to really examine the businesses that you have, but really, before you open up, make sure you prioritize the health and safety of your constituents. And remember how this virus works. The enemy is this virus for which we still have no cure, no treatment, no vaccination. Follow the guidelines that were actually set out by the CDC and other health organizations in terms of how to keep people safe.
Let me ask you about a frightening development that has happened here in New York. We have now at least 3 children who have died from a mysterious illness believed to be related to COVID-19. 2 other deaths are still under investigation. What have you learned about this? What do we know about it as of now?
Yeah, you're absolutely right, Ayman. This is a new development, and it's been a concerning one. First of all, my condolences to the families who've lost children, and for the families who have sick children right now. So, you know, the narrative in the beginning was that children are mostly protected, and it's really adults with chronic conditions who are mostly immune, and older folks. But that's actually not what we're seeing. What we think is happening here, and we're labeling it pediatric multisystem inflammatory syndrome. We think it's associated with COVID-19. These are actually kids who we believe that they got the infection 4 or 6 weeks prior and now are developing this post-infectious type of syndrome. The symptoms there's overlap with Kawasaki syndrome, which is an inflammatory syndrome. What parents need to look out for are fever, abdominal pain, diarrhea. Some kids get a rash and red eyes, but these kids are presenting into the hospital really with shock. In other words, they're hemodynamically unstable, low blood pressure, high heart rate, and they're being admitted to the pediatric ICU. The good news, though, Ayman, is that a lot of these kids do really well. They get treatment is steroids, IVIG or intravenous immunoglobulin, antibiotics, fluids, and they actually do well. So that is good news.
It certainly is. Dr. Lipi Roy giving us the facts this morning. Dr. Roy, thank you as always.